So my name's Steve Boyce. I'm a physiotherapist and I am the director and co-founder of Healthcore. Healthcore was started 5 years ago by my wife Zoe and I after we went through a fairly major health battle, and both of us realised after going through this that often the level of care that we receive from our healthcare system is quite subpar. We also realised that what you need when you're going through something like that is a really good team of people around you. People who are not just super experienced, super passionate about what they do and awesome at what they do, but also people that are really invested in you and who are super driven to improving your life and if possible, getting you better. Essentially, that's what Healthcore is a team of people who are focused and driven to try to improve the lives of people that are going through their own battles with their health. Healthcore offers in-home assessments and treatments in the fields of physiotherapy and occupational therapy and dietetics and soon to be speech pathology as well. The system is set up so that the therapist will go wherever we feel is going to be most beneficial for the patient. And so that could be in the patient's home. Essentially, we structure the treatment around what we feel is going to get the best outcome for the patient. Physiotherapy is a way of treating the body using movement. It could be movement that's initiated by the physio, which would be in the form of hands-on therapy like massage or joint mobilization. It can also be movement that's initiated by the patient, which is either strengthening or stretching exercises. The objective is to try and set up an optimal environment inside the tissue so that healing can take place as quickly as possible and as effectively as possible. And that's what we use movement for. There are lots of different kinds of physiotherapy treatment and areas of specialty, and physios can specialize in one or a multitude of areas. The main one that everyone is aware of is musculoskeletal physiotherapy, and that's where the physios target injuries or disorders of the musculoskeletal system, so muscles and joints and the nerves a little bit as well. When you go in and see a physiotherapist, the first thing you should expect is to sit down with the physio and have a nice long chat about what is bothering you. The crux of it is to really give the physio an idea of the functional impact of the problem, and that's really what we're targeting the most. We're targeting how the problem impacts on your life and what is it stopping you from doing. In conjunction with the physio, we'll help you to formulate a series of goals. And those goals are essentially what you would work towards with the physio, using a variety of different treatment modalities. And the second part involves doing some movement tests. It involves a physiotherapist observing you both in a still position, a static position, and also through a series of movements. And the physio uses their understanding of the human body to figure out what is going wrong and where the movement is breaking down. And again, that's all going to be used in conjunction with the information that gets provided to formulate a plan of attack and how the problem is going to be managed. All of the current research indicates that strength and mobility are the two most important factors in staving off the degenerative changes that happen within the cells as we get older. And I don't just mean physical function, I mean brain function as well, because a lot of the literature actually shows us that brain function changes and improves when a body is subjected to regular strength training. And this has been proven time and time again. And so what that means is that whenever you have an issue that stops you from being mobile, that makes you sedentary and inactive, the older we get, the more of an impact that has on our body's strength. So every day that you spend being inactive causes your body to decline in strength. It gets weaker. And the older we get, the longer it takes to get back to the level that you were at prior to that day of inactivity. And that's where physiotherapy comes in. And when I talk about strength training, a lot of people automatically start thinking of weightlifters and bodybuilders and things like that, and that is not what strength training is only. I mean, that's a part of it, definitely. Going into a swimming pool and moving through the resistance of the water using resistance bands, these are all forms of strength training. And this is the stuff that's been proven to help improve brain function and body function. Working with providers like KompleteCare are so easy to work with because the team are all really driven and passionate, and they're focused on trying to get their clients living in their homes as safely and as happily and as healthily as possible. What we do with KompleteCare is we will get a referral when one of the KompleteCare team identifies or is told by one of their clients that they have a problem of some sort. And it could be a problem with their health, it could be a problem with pain, it could be a problem in their home that's to do with safety. KompleteCare will contact us and will ask us to go out into the client's home, and we will either undertake an assessment where possible and provide a report so that KompleteCare can help facilitate all the changes that need to happen in order to rectify the problem. And we may also at times introduce some treatment, regular treatment. So if the person's got a problem that physiotherapy can help, or occupational therapy can help, or dietetics can help, one of the team will jump in and will start providing treatment to that person on a regular basis. So you can get in contact with one of our amazing admin team by email at info@healthcore.com.au, or you can call us on 088782 5000. And either way, you'll end up speaking to one of the admin team who will have a listen to what you need, and they will connect you with the right person. Thanks.